Hello, my name is Nancy Wolf. I am a clinical instructor for fourth semester nursing students at a community college in Southern California. My topic for discussion is nurse-to-physician communication using the SBAR communication tool. This video will describe characteristics of effective nurse-to-physician communication, review communication barriers faced by healthcare professionals, and explain the use and benefits of the SBAR communication tool. The National League for Nursing directs nursing students to think critically and communicate effectively. California Code of Regulation, Title 16, mandates communication skills be incorporated into student learning objectives. According to the Joint Commission, communication was the root cause of more than 60% of sentinel events in 2006. Improving staff communication is on the 2010 National Hospital Patient Safety Goal List. Communication is effective when both the sender and the receiver understand the same information. Problems can occur at any point of the communication process. Nurses are trained to be detailed and descriptive. On the other hand, doctors are trained to be brief and to the point. Differences in age, gender, race, ethnicity, time constraints, background noise, and use of poor verbal or poor body language are barriers which can prevent effective communication. The SBAR communication tool is a formalized method of communicating information between members of the healthcare team. This SBAR word cloud image was created using Wordle. The tool originated from the U.S. Navy acronym Situation, Background, Assessment, and Recommendation. The tool was refined by the aviation industry and introduced to hospitals by Kaiser Permanente. The tool meets Joint Commission standards. S stands for situation. Why are you calling? What is the problem? Before calling the physician, personally assess the patient. Gather the medical record, vital signs, lab and diagnostic test results, and the medication record. B is for background. What information is relevant? Identify yourself and the nursing unit. Include the patient's name, age, admission diagnosis, code status, and a brief summary of medical history and current plan of care. Be concise. Assessment includes the results of your clinical assessment findings. Focus on changes in condition or abnormal findings, but have information readily available related to the patient's head-to-toe assessment. Finally, R stands for recommendation. What do you want to happen and when? Write telephone orders directly in the medical record and then read them back to the physician to ensure accuracy. Nursing students graduate with little nurse-to-physician communication interaction. Nursing students cannot accept physician telephone orders. Yet, effective communication with physicians is an expectation of new graduate nurses employed in hospitals. Imagine a new graduate placing a 3 a.m. phone call to a physician regarding a change in patient's condition. The result of this communication interaction may be a positive or negative experience for any of the involved parties, the nurse, the physician, or the patient. According to theorist Benner, beginners have no experience with situations in which they are expected to perform. They learn context-free rules to apply universally. The S-Bar tool provides a concise outline for students to communicate with the healthcare team. The characteristics of effective communication include the active practice of delivery and receipt of information within an established expected pattern. Effective communication is a critical element in patient safety and quality of care. Several research studies with nursing students as samples support the significant positive effects of simulated clinical interpersonal skills practice on nursing students' communication skills. Students participate in debriefing after simulated clinical skills practice as a method of self-reflection, assessing the strengths and weaknesses of their communication skills. Does anyone have any questions? Here is a list of my references.